Hi, I'm Deanna with Cancer Care Services. First, I want to convey how grateful we are for your fire service and all that you do as first responders to keep our communities safe. Thank you all for what you do every day. I've been part of the Cancer Care Services staff family for almost 9 years. I also serve on the Fort Worth Firefighter Cancer Focus Group, and I'm honored by both opportunities because both missions are personal to me. My life was changed forever when my daughter was diagnosed with cancer at the age of 5, and I know how a cancer diagnosis impacts the entire family. I now have a son in the fire service in this community, and I am dedicated to helping raise awareness of cancer prevention for all of our firefighters and for providing resources for navigation and knowledge to those with cancer in our community. Cancer Care Services is a boots on the ground organization serving Fort Worth for 75 years. We serve all people, all ages, all cancer types, and we are here for you. In this 12-minute video, you will hear from Melanie Wilson, our CEO, her personal story, and details of our mission. You'll also hear from a social worker who answers the question, I just was diagnosed with cancer. Now what? What can Cancer Care Services do for me? Then to close out, a short video showing the many faces of the staff of Cancer Care Services, showing their why for the passion of our work. Though our building is located in the medical district of Fort Worth, Cancer Care Services is first and foremost about the people who walk the cancer journey with nearly 4,000 people in our community each year. And now I would like to introduce my friend and our CEO, Melanie Wilson.
Hi, everyone. I am Melanie Wilson, and I am the CEO of Cancer Care Services. And I really wish there wasn't a screen between us today, but we want to keep you safe. So the purpose of today is to share our mission, which is to support cancer patients, care for caregivers, and empower survivors, because we want to reduce the impact of cancer right here in Tarrant County. This mission is very personal to me because I have been a cancer patient. I've been a caregiver, and now I'm a survivor. When I was diagnosed with cancer, I was in my 30s and had 3 little girls in elementary school. It wasn't just traumatic for me, it was traumatic for my entire family, especially my kids. But we powered through and eventually felt a huge relief that our family's cancer journey was over. But then my middle daughter, Lauren, was diagnosed with cancer. And soon after, my husband was also diagnosed. This is a picture of them. My husband is a survivor like me, but sadly, my precious daughter, Lauren, is not. We lost her just a few weeks after her 21st birthday. And I honestly don't think I could have gotten through Lauren's death without my Cancer Care Services family. So my own experience has shown me how important our work is. The first thing I'd like you to know about our programs is that 100% of them are provided at no cost to our clients, regardless of how much money they make. Amazing, right? So here's what we do. We support cancer patients by providing cancer navigation, which means we assess the specific needs of each individual person. And once we know their unique situation, we may help them with things like health insurance. We may provide gas cards to help them with transportation. And in response to COVID-19, we've also created a special emergency fund to help patients with crisis needs. For caregivers, the stress of caring for a loved one with cancer is overwhelming. When I was caring for Lauren, I was scared all the time. I felt totally helpless and alone. And this is why we now have a social worker who works solely with caregivers. We also provide free counseling. And since we're social distancing, counseling is just a phone call away. We also have a virtual caregiving class. And finally, we empower survivors. So cancer doesn't simply end after your last treatment, as I well know. Being a survivor has its own set of challenges. So we've launched a survivorship navigation program that provides the same level of support that we provide for cancer patients. So you may be surprised to know that cancer is the leading cause of death in Tarrant County. So based on our population and cancer rates, 800,000 people will be diagnosed with cancer right here in our own backyard. Many, many things have changed in our world since March, but Cancer Care Services hasn't wavered in our commitment to serving those who are struggling because of cancer. So my hope is that if you or anyone you love ever hears the words "you have cancer," you'll know that we are here for you now and for generations to come. Thank you so much for your time today.
Hi, I'm Ray on the development team of Cancer Care Services, and this is Niels, one of our social workers. And I just wanted to take a little bit of time to ask him the question about how the intake process and what Cancer Care Services does when somebody with cancer or a loved one is calling about somebody with cancer. What happens when they make that phone call and a social worker answers the phone for them? So, Nels, I just want you to kind of walk us through a little bit about someone calls in and then they get transferred to a social worker. What kinds of things are they talking about, or what are they being asked?
At the beginning of the process, we typically just ask for contact information. We want to make sure we don't get disconnected from you. And we typically also ask for what county you're in, because most of the time counties can change based on resources. And then from there, we kind of get into more in-depth questions about what the situation is like.
Or what kinds of resources are you going to be able to assist them with in-house within Cancer Care Services?
So in-house, we have a few different programs. Primarily, we focus on prescription medications like pain meds, nausea medications, typical things that go along with whatever treatment you're going to be receiving at the time. We can also help out with premiums, whatever you're paying towards your medical portion of the premium. We can also help out with nutrition if you have a tube feeding or a head and neck based cancer diagnosis, and then gas cards and potentially some physical forms of transportation, depending on how frequent the need is and how emergent the need is.
So those sound a lot of like a lot of financial services, and I do know that there's a qualification for financial services at Cancer Care Services. What if somebody doesn't necessarily meet those qualifications? What kinds of things can Cancer Care Services provide to somebody outside of the financial realm?
So we can still provide things like counseling services, along with financial navigation to discuss what your insurance options may be, along with how best to approach medical bills and how best to pay them off over time, as to avoid affecting your credit too poorly. We can also provide just general case management. So if you're needing help with food, or if your county or office tends to have available transportation, we can research those options for you. We can normally look into potential ways of negotiating your mortgage, or trying to figure out the best rent possibility for yourself, along with housing options, and whatever food assistance you may be needing at the time as well.
And these are referral resources from other organizations?
Yes, so we have a very good network, and most of our social workers keep in contact with.
So what's kind of the time frame, if any, for the amount of time somebody as a client can be with a social worker or continue to call a social worker?
So there is no time frame for you to get the case management services that we do offer. As long as you have cancer or even are a survivor, we can still be here as a referral or a soundboard for you. As far as financial services go, we do typically go 6 months at a time. So at the end of 6 months, we kind of reevaluate and see if you can approve for another 6 months of financial services, and we kind of move forward that way. But as far as discussing anything with a social worker, that is always available no matter what.
So tell me a little bit more about the counseling services. What type of client generally uses those services?
So right now, our counseling services are limited to Tarrant County. We do also refer out. So if you are living in Johnson, Dallas, we can also provide counseling resources for those areas. As far as what kind of potential patients use them, we can see the client themselves as well as the caregiver and any children that are also kind of being affected by the cancer diagnosis.
So Nels, outside of like county and direct referral resources that we have within our area, what other kinds of things might a social worker be able to provide to a client that maybe aren't so health related?
So we can definitely advocate and advise as far as things like Social Security go. A lot of times patients try to apply for disability and need to know the best, quickest way to get through that process because it is a long process. We can also help informing patients on how to best go about applying for medical power of attorney paperwork, advanced directives, which is basically a way of kind of advising your doctor, your oncologist, your PCP about what your wishes would be given a current situation. And we can always go forward and kind of giving you advice on who to go to if you're trying to set up a living will or paperwork like that.
This is a great conversation and I enjoyed speaking with you. Thank you.
Thank you, Ray.
I am resilient, I trust the movement, I negate the chaos, uplift the negative. I'll show up at the table again and again and again. I'll close my mouth and learn to listen. Whoa, whoa, oh, oh. 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 These times are poignant, the winds have shifted. It's all we can do to stay uplifted. Pipelines through backyards, wolves howling out front. Yeah, I got my crew, but truth is what I want. Realigned and on point, power to the peaceful, prayers to the waters, women at the center, all vessels open to give and receive. Let's see the system brought down to its knees.